If you're thinking about retiring before the age of 65 and you're Medicare eligible, one of the biggest unknowns, biggest fears, biggest reasons to work one more year is what are you going to do about health insurance? I get this question all the time. Joe, what are you doing around health insurance? I made this journey alone, and I'm telling you, it was stressful and it was painful, and I didn't feel like I had any assistance. I was on my company insurance for my entire adult life. And now, there you go. Decide, what are you going to do? I was 54. And luckily, a friend of a friend mentioned an option to me. It happened to be Indiana Farm Bureau that worked out for me perfect. I'll go into that more in a little bit. May not be the right answer for you, but this journey alone, there's got to be a better way. Well, I got something brand new to share with you today, and I am super excited about this. This has been on my mind for a couple years, and finally it's just come together this morning. I do pride myself in providing solutions. You know, I'm an engineer. I don't just like saying this is a problem, this is stressful. I like giving you a solution. That's how I am wired. This solution today is free, totally free to you, okay? No cost, okay? Free. Move Health, MOVE, and I'm going to have a link to them below. They're actually based in my hometown, and I've met them live at their offices on 2 different occasions. These folks are experts and exclusively work with people that are early retirees and transitioning into Medicare and their later retirement years. They exclusively, until now, worked with certified financial planners around the 50 states. Okay, that's what they do. They don't provide general insurance to the general public. They only get referrals from certified financial planners. So their game is, how do we solve this problem for early retirees and transition retirees going into Medicare off their company plan? That's what they do every day, all the employees. Okay. They're adding a test with my audience, only my audience. This is exciting. And again, this is for retirees and early retirees with nothing complex. Their job is to make this simple, no pressure, just guidance. Okay. So before I talk about Move Health a little bit more, let's be honest. Health insurance is probably overwhelming to you if you're considering retirement. Let's talk about 8 pressures and stresses I faced when I was exiting the workforce. Number 1, way too many options, more than I expect. Whatever you do, don't go online and type in health insurance and enter your information. You'll get inundated with phone calls and options. Most people think there's just COBRA, which is continuation of your existing benefits, but you pay the full premium, not, the company doesn't pay their 2/3. Or there's the Affordable Care Marketplace. That's what a lot of people think that's all there is. But there's private options, there's health shares, and many creative solutions out there that are state by state specific that I don't even know about. I didn't know about Indiana Farm Bureau until a friend of a friend told me. It worked out. I liked Indiana Farm Bureau because it was not limited to my state of Indiana. I could go to professionals outside of the state and, specialists if that happened. And we travel a lot. They're in the United Healthcare umbrella, so there's a lot of hospitals. They also covered preventative work, and like mammograms and colonoscopies, things like that. And I wanted that to be included in the price, and it was substantially cheaper than the Affordable Care Act for me. Great. Okay, so number 2, stress, pain, sticker shock. Some people are looking at $1,500 to $2,000, maybe even more on the Affordable Care Act, Obamacare, some people call it. There are some strategies to reduce your income on paper so you can get more subsidies. There's different plans, like I said, private pay plans that can make a huge difference in you retiring a year or 2 earlier. Number 3, pain, is You're buying insurance outside of your network for the first time. You know, I'm used to going on a website and selecting the plan and go. I've got 3 choices, pick one of the 3. Now you got dozens of choices and it can be overwhelming. And you used to have HR to talk to and coworkers. Now you're kind of on your own. You suddenly find you're the business unit manager. You got all these confusing things like deductibles, networks, and premiums to work out. Number 4, pain, the spam calls and sales calls. I'm telling you, I've made this mistake. Gone in, did a Google search, typed in insurance, typed in my phone number, typed in my email, and I'm telling you, the phone will ring within 5 seconds, and then it'll ring within 10 seconds, and then 20 seconds. You finally have to shut off your phone. It is amazing. You're going to get inundated with people trying to sell you things. Now, they're not all bad, but are they specialists in retirement and pre-retirement, that transition too? Most of them they're providing to the general public, the 20-year-old to the 80-year-old, okay? And that's what I love about Move Health. They're specifically for my audience here. I'm excited. Hopefully you can tell. Number 5, hey, there's no fee for this professional help. That's great. Let's see, the fee is paid by the insurance providers like Blue Cross Blue Shields, the United Healthcare, the other ones that are out there. Number 6, another pain is how are you going to transition to Medicare from what you're currently on to Medicare? Who gives you guidance on what to select? When you turn 65, Move Health has that. That's what they do. 100% of their clients, that's what they do. Number 7, let's see, subsidy traps. These are the subsidies associated with the Affordable Care. You really need to know what you're doing when you're managing where your income is coming from. If you take it from a Roth, it doesn't count towards your subsidy, towards your income. If you're taking it from a traditional IRA, it does count. So take it out of a cash account, doesn't count. Okay, so managing your subsidies, these people will walk you through all of that so you understand what you're doing and compare different plans so you don't have to do it by yourself. Also, what happens if you relocate? What happens if you're going to be a snowbird and live 3 months in Florida? What happens if you want to travel 6 months of the year? What's the best plan for you? That's what these people do all the time. Okay, so let's enter the discussion with Move Health. Move Health's entire mission is to simplify health insurance for people that are in early retirement, choosing early retirement, transitioning into Medicare. That's what they do, and they have exclusively been with certified financial planners. They don't advertise to the general public. They use technology, they have some software, they find plans to meet your needs and budget. They'll compare the ACA, the private insurance, specialty options that may be out there, all side by side, make it easy for you. Like I said, I can't stress enough, they serve financial planners only right now, so they're only targeting retirement people. I know I'm being repetitive, but that is a big deal. These people are experts in what you need. They're extending this service just to my audience as a trial, okay? Just as a trial. I'm hoping this turns into an affiliate relationship, but we don't have that right now. We're just seeing what is the need out there, and I think it's big, so I really want you guys to hit this link and sign up. There's no cost. They're, like I said, paid by the insurance carriers. Here's how it works. Okay, I'm going to have a Move Health link. Okay, it's going to be the first one you come to. You hit more till you hit the show notes. You're going to fill out a short form, things like your age, what state you're in, expected income, so they can kind of match you with the right person. You don't want to match up with somebody from Indiana if you're from California. Okay, makes sense? You'll be paired with a licensed advisor that's going to walk you through the options and answer your questions. A professional, licensed person specifically for retirees. You will it'll then kick you to a calendar. Okay, just this link will get you to a calendar, and you pick a date and time you want to meet. No spam, no call centers, just a trusted contact who helps you find what you need. Now, for full transparency, I'm hoping this turns into an affiliate, but they are not that way right now. I'm just promoting them, which means if you decide, if I am an affiliate, if you decide to go with them, they will give me a finder's fee for that. No cost to you. No cost to you. So don't worry about that. Let's see. Health insurance is one of the biggest unknowns when I left my corporate job. Biggest fears. What am I going to do? What am I going to do? I asked everybody. I managed it myself. I came up with a good solution, which was Indiana Farm Bureau. I like it. I'm still on it. Been on it 5 years or so right now. But Move Health would have just made this a 2-hour event for me instead of a 40-hour event and a guess. I shudder to think of what would have happened to me if I would not listen to somebody in the hallway mention Indiana Farm Bureau, which is only in like 7 states do they have a farm bureau that provides health insurance. Okay. So, this Move Health, here's the action. Okay. It's free, it's private, and it could save you thousands of dollars, maybe make you retire 1 or 2 years earlier because they found an option for you that is thousands less than what you thought you were going to need based on your spreadsheets and maybe your Boldin software. And if you've already got coverage, check them out. See if you've got the lowest cost option. I'm planning on doing this, okay? Make sure that you got the best options. It doesn't cost you anything. Be on the phone, 20, 30-minute call. Find out if you've got the best option that's out there for your specific situation. Now, here's one catch. This is their busy season. This is when everybody's signing up for affordable care. This is when a lot of people choose to retire at the end of the year, so they're kind of busy. If you're retiring in the next few months, go ahead and click the calendar update and pick something earliest as possible. Everybody pick a calendar time, but I ask you, they're asking me to give priority to those people that are retiring at the end of this year. So pick a date on January 2nd, January 5th, January 15th, something like that. If you're not retiring in the next few months, go ahead and sign up. Get this out of the way. I'm telling you, you may retire a year or two earlier with this, so don't delay. But maybe I'll say that simpler. If you're not retiring by the end of the year, take a calendar date that is in January or later, okay? So that the people that need this service, I'm expecting them to be a little bit overwhelmed. Go ahead and sign up. Go ahead and sign up. But let the November and December dates go to people that are retiring at the end of this year to give them a better option. So I am excited about this. Please like and subscribe if you like this content. I'm sharing my journey to help you on your journey. And this is one that I haven't been able to solve till this morning. I love this option for you. It's totally free. It's a professional in your corner on health insurance. It's Joe out.